Welcome to the Therapy by Choice podcast, where we offer educational information on a variety of mental health topics. We speak to specialists in the field, and we answer your questions. My name is Robyne Vance. I am an associate marriage and family therapist here at Therapy by Choice and your host for this podcast. Therapy by Choice is a private practice located in San Jose, California. At Therapy by Choice, we provide both in-person and virtual therapeutic services for individuals, couples, and families. People seek therapy for many reasons, whether you are a couple needing more insight into your relationship, a couple on the verge of breaking up, an individual who may be experiencing depression, anxiety, or career changes, or families grieving the loss of a loved one or needing guidance. Here at Therapy by Choice, we are skilled and prepared to help in many areas. A listing of our specialties can be found at www.therapybychoice.com and click on Services. We do offer a free 15-minute consultation for you to speak with a therapist to see if therapy and the therapist are a fit for your needs. To speak with us to see how we can meet your needs, please call or text us at 408-786-9651. That's 408-786-9651. Or visit our website at www.therapybychoice.com, where you can read about our practice, the areas in which we offer services, and read about our staff. That's www.therapybychoice.com. Therapy by Choice, helping clients feel better. Welcome to the Therapy by Choice podcast. My name is Robyne Vance. It can be confusing when you're seeking care for mental health to know what a psychiatrist does versus what a psychologist does versus what a therapist does. In this episode, I'll be providing you a breakdown of the different types of mental health professionals there are and a little bit about their roles. Now, before we jump into our list, please know that some of the designations used may be specific to the state of California. Most mental health professionals are trained to work with all populations, but some will focus on specific populations where they will do their work. For example, a school counselor or a child psychiatrist. Whereas all mental health professionals can provide a diagnosis for mental health conditions, we may find at times we need something specific like an assessment or evaluation or medication. It's important when you are speaking with providers to ask what their specialty is and what populations they are able to work with. So let's start off by talking about assessments and evaluations. Who do you go to if you need a psychological assessment, such as for ADHD or an aptitude test or an intelligence test? Although most mental health professionals have received some training on these during their graduate program, psychologists hold a doctoral degree and are trained to evaluate a person's mental health by using clinical interviews, psychological evaluations, and testing. You may see them listed as PhD or PsyD. Some psychologists may offer therapeutic services in addition to evaluations and testing. Next up, I call these the talk therapy group. These are your therapists, counselors, and clinicians. These master-level healthcare professionals are trained to evaluate a person's mental health and use therapeutic techniques based on specific training programs. They operate under a variety of job titles, including counselor, clinician, therapist, or something else based on the treatment setting. Now, working with one of these mental health professionals can lead not only to symptom reduction, but to help with better ways of thinking, feeling, and living. Some may have specific areas they focused on during their master's program as well, such as industrial organizational psychology, etc. You may see them listed as LMFT or LPCC. Now, clinical social workers are trained to evaluate a person's mental health and use therapeutic techniques based off specific training programs, but they are also trained in case management and advocacy services. You may see them listed as LCSW. Now, in the state of California, you may also see mental health professionals listed as ACSW, APCC, or, like myself, AMFT. This designation is for individuals nearing full licensure as LCSW, LPCC, or LMFT. Now, lastly, because mental health may be collaborative, let's discuss providers who can offer medication management when needed. A psychiatrist is a medical doctor specializing in mental health. Psychiatrists are able to diagnose, treat, and manage mental health conditions, with their main role being prescribing medications. Some psychiatrists may also do assessments and offer talk therapy, but many focus on the managing of mental health conditions with medication. A primary care doctor can prescribe medications, including antidepressants and anti-anxiety medications, and are usually the first point of contact when people think of medication. Your primary care doctor may perform a routine well check to rule out any other issues. Now, because primary care physicians may not specialize in mental health, they may ultimately refer you to a psychiatrist and/or a therapist. Now, I know you may think I've forgotten about a couple of groups, but I haven't. Let's address drug and alcohol counselors and life coaches. In California, there are many types of drug and alcohol counselors. These roles often require some amount of schooling, practicum, as well as certification. Now, they are considered mental health professionals as they do provide treatment, support, and counseling to those with substance use disorders, as well as they may address some mental health components of substance use and addiction, like anxiety and depression. Now, some may see a drug and alcohol counselor in addition to seeing another provider, like a therapist or a psychiatrist, for medication management. Lastly, I want to discuss life coaches. While a life coach can help you identify and work towards goals and offer ways to help keep yourself motivated, and you may even see a therapist who is also a life coach, life coaches alone are not considered mental health professionals, as there is no required education or certification needed to become a life coach. They are not trained or qualified to treat or diagnose mental health conditions, and life coaches aren't required to be regulated by any state or federal board. I know that was a lot, but I want to thank you for joining me for this episode of the Therapy by Choice podcast. Don't forget to like and share this podcast, and feel free to reach out if you have questions or if you would like to see a specific topic covered. You can text us at 408-786-9651 or email us at robyn@therapybychoice.com. That's Robyne, Robyne, at therapybychoice.com. Also visit our website at www.therapybychoice.com. My name is Robyne Vance. Take good care. While we hope to provide insight and education, our podcast does not replace therapy, and listening to our podcast does not establish a therapeutic relationship. If you or someone you know are in crisis, please call the Suicide and Crisis Lifeline by dialing 988.